Zinc, though needed in relatively small amounts compared to other minerals, is absolutely essential for the human body, and it's particularly important for the overall health and well-being of men. This trace mineral, even though it's required in modest doses, is a real powerhouse, participating in a vast number of enzymatic reactions, helping to regulate hormones, strengthening the immune system, supporting reproductive functions, and generally contributing to a man's overall energy and vitality. It's often affectionately called the element of love because of its wide-ranging effects on male reproductive health, influencing everything from sperm production and the maintenance of stable testosterone levels to ensuring the prostate stays healthy. To truly understand how essential zinc is, we need to take a closer look at its biochemical functions, its impacts in real-world clinical settings, and the potentially serious problems that can occur when a man doesn't get enough of this undeniably important mineral. When you're talking about male sexual health, testosterone is undeniably the star of the show. This hormone is really what defines male characteristics, playing a crucial role in building muscle mass, deepening the voice, promoting the growth of facial hair, and, of course, fueling sexual desire. The body's ability to produce testosterone is heavily dependent on zinc. Zinc is found in high concentrations within the testes, specifically in the seminiferous tubules and accessory glands. There, it acts like a catalyst, jump-starting the enzymes responsible for converting cholesterol into testosterone. When a man doesn't have enough zinc, this entire process can be thrown off balance, leading to lower testosterone levels and causing issues like a reduced libido, erectile dysfunction, and problems with fertility. Research conducted on both humans and animals has clearly demonstrated that a diet deficient in zinc can lead to a rapid decline in testosterone levels, sometimes in just a matter of weeks. On the flip side, making sure to get enough zinc, either through food or supplements, can help restore testosterone levels to a more normal range, reigniting that lost spark. But zinc's benefits aren't just limited to affecting testosterone levels. It's also directly involved in the development and motility of sperm. Semen actually contains significantly higher concentrations of zinc than plasma, and this fact alone really highlights just how important zinc is for male fertility. Healthy sperm need strong cell membranes, tails that are flexible enough to allow for rapid swimming, and of course, stable DNA. Zinc plays a vital role in stabilizing the chromosomal structure, preventing DNA fragmentation, and protecting sperm from the harmful effects of free radicals. A zinc deficiency, on the other hand, can weaken sperm, potentially leading to deformities, a lower sperm count, and decreased motility. Numerous studies focusing on male infertility have shown that zinc supplementation, especially when combined with other important micronutrients, can significantly improve both sperm count and sperm quality, offering real hope for couples who are trying to conceive naturally. Another aspect of zinc's importance that is often overlooked is its crucial role in keeping the prostate healthy. The prostate gland actually has one of the highest concentrations of zinc found anywhere in the body. Zinc helps to protect the prostate from inflammation, regulates its secretions, and can help prevent both prostate enlargement and even cancer. Men who are deficient in zinc often experience urinary problems such as difficulty urinating, frequent urination, or pain in the prostate. They might also experience impaired ejaculation, and all of these issues can have a major impact on their overall quality of life. Research has suggested that zinc supplementation can help reduce the risk of benign prostatic hyperplasia, commonly known as BPH, and improve sexual function in older men, promoting both comfort and self-assurance. Zinc is also closely linked to erectile function, which is, of course, critical for a satisfying sex life. Achieving an erection relies on the dilation of the blood vessels in the penis and the release of nitric oxide, often abbreviated as NO. Zinc activates enzymes that are directly involved in the synthesis of nitric oxide, which in turn improves blood flow to the penis. If a man doesn't get enough zinc, it can impair vasodilation, leading to erectile dysfunction, a concern that many men find extremely difficult to even talk about. This explains why men with poor zinc intake, or those who have chronic conditions that deplete zinc, such as diabetes or kidney disease, often have trouble maintaining an erection, which can negatively affect their lives and their relationships. Beyond these very direct biological effects, zinc also influences a man's overall health, which indirectly affects his sex life. A body that is tired, run down, and has a weak immune system is far less likely to support a healthy sex life. Zinc strengthens the immune system, helps wounds heal, fights inflammation, and protects the body's mucous membranes. When men are suffering from colds, sore throats, or chronic infections, their weakened health can decrease their libido, making sex difficult and, frankly, unenjoyable. Zinc supplementation can speed up the recovery process, which indirectly improves sexual function, restoring a man's energy and self-confidence. In clinical practice, sexual dysfunction often stems from micronutrient deficiencies, particularly zinc, rather than from actual diseases of the genitals. Vegetarians, heavy drinkers, smokers, and people with chronic intestinal diseases are all more likely to be deficient in zinc. Symptoms of zinc deficiency can include a decreased sense of taste, hair loss, dry skin, a weakened immune system, lower testosterone levels, and reproductive dysfunction. Doctors often order micronutrient tests for patients who are experiencing infertility, and these tests frequently reveal a widespread zinc deficiency, serving as a clear warning sign that emphasizes the importance of zinc supplementation. Seafood is undoubtedly one of the best sources of zinc. Oysters in particular are among the richest sources and have long been associated with male enhancement, often being considered a true gift from the sea. Red meat, organ meats, pumpkin seeds, beans, cashews, and whole grains are also good sources of zinc. However, the absorption of zinc depends on how the food is prepared and what other components are present in the diet. Phytates, which are found in whole grains, can hinder zinc absorption, while animal protein enhances it. A balanced diet that includes both animal and plant foods optimizes zinc absorption, ensuring an adequate intake. For those with higher zinc needs or who are at risk of deficiency, zinc supplements can be used under medical supervision to effectively address any deficiencies. However, it's important to keep in mind that more zinc isn't always better. Adult men need around 11 milligrams of zinc per day, and possibly a little more for those who exercise regularly or have a high level of sexual activity. Excessive zinc intake, especially over 40 milligrams daily over the long term, can cause some unpleasant side effects such as nausea, abdominal pain, immune dysfunction, and, importantly, reduced copper absorption, which is another vital mineral. Maintaining a healthy balance is crucial for optimal health. In addition to diet and supplementation, a healthy lifestyle can definitely help maintain stable zinc levels. It's important to avoid excessive alcohol consumption, as ethanol increases urinary zinc excretion, leading to its loss. Managing any chronic conditions, such as diabetes and kidney disease, also helps conserve zinc. Regular exercise, getting enough sleep, and reducing stress all contribute to maintaining optimal testosterone levels, which maximizes the benefits of zinc. From a socio-cultural perspective, highlighting the role that zinc plays in men's sexual health can raise awareness within the community. Sex remains a sensitive topic in many cultures, often making men reluctant to discuss sexual problems, which unfortunately hinders proper treatment. Educating people about the fact that a simple mineral like zinc can significantly improve sexual health can help them approach the issue more openly and seek medical help sooner, preventing more serious conditions and unhappiness. Epidemiological studies have shown that countries where diets are rich in seafood and zinc generally have lower rates of male infertility, providing further evidence of zinc's impact on reproductive health. Conversely, regions where diets are mainly vegetarian or where people consume primarily zinc-poor grains tend to have higher rates of infertility and sexual dysfunction, really emphasizing the importance of a balanced diet. This clearly demonstrates a direct link between dietary zinc and male fertility at a population level, requiring both attention and effective solutions. As men get older, testosterone naturally declines, which is an inevitable part of aging. But zinc deficiency can accelerate this decline, negatively affecting a man's quality of life. Maintaining an adequate dietary zinc intake can help slow down sexual aging, preserving a sense of youthfulness. While zinc can't completely prevent the decrease in testosterone, it can certainly delay it, helping men maintain their vigor for longer, extending their youth and allowing them to enjoy life more fully. It's also interesting that foods considered to be aphrodisiacs in traditional medicine and folklore often happen to be rich in zinc. For example, grilled oysters, other seafood, salted roasted pumpkin seeds, and organ meats have all been used for centuries without a complete understanding of their underlying mechanisms. Modern science now explains that the zinc content in these foods plays a vital role in maintaining male strength, finally explaining ancient mysteries and validating time-tested experiences. Combining traditional knowledge with modern scientific evidence reinforces the importance of zinc for male sexual health, creating a powerful blend of the past and the present. Zinc also affects the brain, which is crucial for overall well-being. A zinc deficiency can cause anxiety, depression, and reduce motivation and interest in life, all of which negatively affect a man's mental health and his social relationships. These psychological issues can directly reduce libido in men, making life feel dull and unfulfilling. With proper zinc supplementation, many patients report feeling more relaxed and confident, which can significantly improve their sex lives, leading to a noticeable and positive transformation. This really highlights the close relationship between psychological and physiological factors in male sexual activity, highlighting their inseparable connection. In conclusion, zinc plays a multifaceted and vital role in male sexual health, acting as an indispensable partner on the path to happiness and well-being. From maintaining stable testosterone levels and supporting sperm formation to protecting the prostate, improving erectile function, strengthening the immune system, and enhancing mental health, zinc is an essential element, a real key to overall wellness. A zinc deficiency can lead to a variety of health problems, including a decreased libido, erectile dysfunction, infertility, prostate enlargement, and a weakened immune system. All common concerns that require timely attention and resolution. Making sure to get enough zinc through a balanced diet and a healthy lifestyle is crucial for maintaining long-term sexual health, which is a worthwhile investment, not just for the future but also for family happiness. Men of all ages, but especially those who are middle-aged and older, should pay closer attention to ensuring they get enough zinc every day. It's a simple step that can provide significant long-term benefits. It's a natural, safe, and effective solution for a satisfying sex life while also protecting overall health, ultimately leading to a more complete and happier life.